Welcome back. Today's topic of discussion is parts of a long bone with a bit about ossification. Let us recapitulate the features of long bones. Long bones are weight bearing, the length is more than the breadth, it has a shaft or body, and it has two expanded ends. The expanded ends are enlarged articular and capped with articular hyaline cartilage. The shaft, it consists of a tube of compact bone and contains medullary cavity. It consists of three surfaces separated by three borders. And long bones ossify or are preformed in cartilages. Next is parts of a young long bone. A young long bone consists of a shaft or diaphysis. It has two expanded ends. These are the epiphysis. The metaphysis is the part of the diaphysis which is facing the epiphysis. So these are the metaphysis. And the epiphysis is separated from the diaphysis by the epiphyseal cartilage. This is a picture of a fetal skeleton at 12 weeks. The regions which are appearing red have undergone ossification. We can see that the bones of the vault of the skull have undergone membranous ossification and the long bones have undergone endochondral ossification. However, the region of the wrist, the elbow, the knee are still cartilaginous and are appearing translucent. So in early fetal life, a long bone is preceded by a model of hyaline cartilage. What is ossification? The process of bone formation is known as ossification. And the areas where bone formation or ossification starts in the cartilaginous model is known as center of ossification. There are two centers of ossification. One is the primary center, the other is the secondary center. Primary center is that from which the main part of the bone is ossified. In case of a long bone, the shaft or diaphysis is ossified from the primary center. It usually appears before birth. Secondary center is that from which the accessory part of the bone is ossified. The epiphysis of a long bone, it develops from the secondary center and it usually appears after birth. This is a schematic diagram. I have only represented the shaft or diaphysis of the long bone and have taken the liberty of omitting the epiphysis as of now. The cartilaginous areas are represented in pink and crosses. So in early fetal life, a long bone is preceded by a model of hyaline cartilage. So this pink area is still in the cartilaginous stage. Then in this cartilaginous model, the process of ossification will start. The area where bone formation or ossification start is known as the center of ossification. So this is the center of ossification that is in the shaft or diaphysis of the long bone. It is represented by this blue color. Next, so the primary center is that from which the main part of the bone is ossified. And in this case, it is the shaft of the or diaphysis of the long bone. So at birth, we can see that the shaft or diaphysis of the long bone is ossified. So at birth, this X-ray, it is showing that the shafts of the long bones are ossified, but the ends, that is the epiphysis, are still cartilaginous. So this is the humerus, this is the radius, and this is the ulna. So after birth, we can see that the shaft of the long bone is already ossified and the shaft is separated from the epiphysis by means of the orange colored epiphyseal cartilage. So the ends are still cartilaginous. Then what is going to happen is that the secondary center of ossification is going to appear at one end of the long bone. So the secondary center of ossification is that from which the accessory part of the bone is ossified. So the epiphysis of the bone is developed from the secondary center. So over here we can see at the upper end of the long bone, a secondary center of ossification or epiphyseal center has appeared. In this diagram, we can see that the epiphysis at the upper end of the long bone is enlarging in size and another epiphyseal center has appeared at the lower end of the long bone. In this diagram, we see that as the child grows, the bone will increase in length and the epiphysis will also enlarge. Now about union of epiphysis. A typical long bone presents epiphysis at each end. The epiphyseal union does not take place simultaneously at both ends. One epiphysis will fuse with the diaphysis earlier than the other one. The epiphysis which unites last with the diaphysis grows for a longer period before union. Hence, it is known as the growing end of the bone. So, according to the law of union of epiphysis, the epiphyseal center which appears first unites last with the diaphysis and vice versa. In our schematic diagram, we had seen that the epiphyseal center in the lower end was the last to appear, and hence it will be the first to unite with the diaphysis. And since the epiphyseal center at the upper end, it appeared first, hence it will unite last with the diaphysis. It will be the growing end of the bone. So over here we can see that in the lower end, the epiphyseal cartilage has disappeared, and we can see a line separating the diaphysis from the epiphysis. But in the upper end, we can still see the epiphyseal cartilage is persisting. So let us again revise. The law of union of epiphysis enunciates that the epiphyseal center which appears first unites last with the diaphysis and vice versa. In the last diagram, we can see that the epiphyseal cartilage at the upper end of this long bone is also replaced by bone. The epiphyseal cartilage is no longer seen. So as long as the bone grows in length, the epiphyseal cartilage persists. When the full length is reached, that is usually after puberty, this cartilage will be replaced by bone. So we can see the line of fusion between the epiphysis and the diaphysis. Later on, these lines will also disappear, and we will get a smooth structure of the long bone. So this is the stages in the development of a long bone. So let us recapitulate the parts of a young long bone. The diaphysis is the part of the bone developed from the primary center. The epiphysis is the part of the bone developed from the secondary center. The epiphyseal cartilage is a plate of hyaline cartilage which intervenes between the epiphysis and diaphysis. It persists as long as the bone grows in length, and after puberty, it will be replaced by bone. The metaphysis is the end of the diaphysis which is facing the epiphyseal cartilage. It is the most actively growing area of a bone. It has profuse blood supply through hairpin loops, and hence it is a common site of infection because the bacteria and the microorganisms, they get stuck in the hairpin loops. Now we have to learn about certain exceptions. We have learned that the primary center, it appears before birth. But there is an exception. The primary centers of the tarsal and the carpal bones, these are the short bones, they appear after birth, except the talus, calcaneus, and the cuboid, which starts ossification in the intrauterine life. The secondary center appears after birth, except the lower end of the femur and the upper end of the tibia, which appears just before birth in the 9th month of intrauterine life. Now, this is very unique because this bears some medical legal importance because its appearance shows the maturity of the fetus. Next, we have to learn about growing end of the bone. The growing end of a bone is that end where the secondary center appears first and unites last with the diaphysis. The growing end is directed opposite to the direction of nutrient foramen. The nutrient foramen, it conveys nutrient vessels to the long bone and is situated near the middle of the shaft of a long bone. The direction of the nutrient foramen of the long bone can be remembered by using the following dictum: to the elbow I go, from the knee I flee. So, in the upper extremity, the shoulder and the wrist end of the bones are the growing ends, and in the lower extremity, the knee end of the femur, the tibia, and the fibula is the growing end. The knowledge of the growing end is important in clinical practice because if injury or infection affects this area, it may make the bones stunted. Now, fibula is a unique bone. Here, the law of union of epiphysis is violated. This is a schematic diagram. We can see this is the shaft which is ossified from primary center of ossification, and the ends, that is the upper and the lower ends, they are still cartilaginous. Now we can see that at the lower end, the epiphyseal center appears first at 1 to 2 years. This is followed by the appearance of the epiphyseal center at the upper end at 3 to 4 years. At the lower end again, we can see that the union of the epiphysis with the diaphysis is occurring at 15 to 17 years. And at the upper end, the union of the epiphysis with diaphysis occurs at 17 to 19 years. Thus, we can see the epiphyseal center at the lower end is appearing first and uniting first. And at the upper end, it is appearing late and also uniting late. So we can see that the law of union of epiphysis is violated. So let us explain why this is happening. In fibula, the upper end is a traction epiphysis. It is because of the pull of the biceps femoris, whereas the lower end, it is a pressure epiphysis which transmits the weight through the ankle joint. When a long bone possesses two types of epiphysis, pressure and traction, the ossification center of the pressure epiphysis appears earlier than that of the traction epiphysis. Now, since the lower end of the fibula, it is a pressure epiphysis compared to the upper end, hence the epiphyseal center of the lower end, it appears earlier than that of the upper end. Now, since the growing end of the fibula is at the upper end, according to the direction of nutrient foramen, it unites with the diaphysis last, although its epiphyseal center also appears last. So, has the law really been violated? Yes, because the law states that the center which appears first unites last. The statement regarding the pressure epiphysis appearing earlier than the traction epiphysis is not a part of the law. What are the types of epiphysis? These are according to origin and function. We have the pressure epiphysis, traction epiphysis, and we have the atavistic epiphysis. Let us discuss. So pressure epiphysis, it helps in the transmission of body weight and protects the epiphyseal cartilage. Example is the head of the femur and the humerus and the condyles of the femur and the tibia. So this is the head of the femur. It is a pressure epiphysis. This red color region, it is the epiphyseal cartilage, which is separating the head from the shaft or diaphysis. Next is traction epiphysis. Traction epiphysis is produced by the pull of some muscle. For example, trochanter of the femur and the tubercles of the humerus. So this is the greater trochanter of the femur. This is the lesser trochanter of the femur. These are examples of traction epiphysis. Next, we have atavistic epiphysis. It is actually an independent bone which gets attached secondarily to a host bone to receive nutrition from the host. So it grows like a parasite. Example is coracoid process of the scapula. There is another type of classification of the epiphysis. If more than one epiphysis is present at one or both ends of a long bone, we may have simple epiphysis, compound epiphysis. Simple epiphysis is when the individual epiphysis unites with the diaphysis by a separate epiphyseal plate. Example is the upper end of the femur. An example of simple epiphysis is the upper end of the femur. So this is the head of the femur, greater trochanter, lesser trochanter, and these are separated by separate epiphyseal plates from the diaphysis or the shaft. So the head of the femur, it unites with the diaphysis by a separate epiphyseal plate. Same with the greater trochanter and the lesser trochanter. So this is a case of simple epiphysis. The upper and lower ends of the humerus are examples of compound epiphysis. Here, when multiple epiphyses unite first with one another and then fuses with the diaphysis, it is a case of compound epiphysis. This is a schematic diagram showing the upper end of the humerus. We have three epiphyses, one for the head, one for the greater tubercle, one for the lesser tubercle. Now, the epiphysis for the head of the humerus, it appears at 1 year, showed by this blue color. Next, at 3 years, the epiphyseal center for the greater tubercle appears. Then at 5 years, the epiphyseal center for the lesser tubercle appears. Next, at 6 years, we can see that the epiphyses for the head, the greater tubercle and the lesser tubercle, they have fused among themselves to form a compound epiphysis, which is separated by an epiphyseal cartilage with the diaphysis. And at 20 years, the compound epiphysis will unite with the diaphysis. So this is the compound epiphysis. Example, upper end of the humerus. This is an X-ray showing the shoulder region. of a baby at birth, we can see the shaft is ossified and the epiphysis of the head of the humerus is absent. Next, at 1 year, we can see the epiphysis of the head of the humerus has appeared, this white rounded shadow. At 6 years, we can see that the epiphysis of the head, the greater and the lesser tubercle, they have fused to form a compound epiphysis, but it is still not fused with the diaphysis. Above 20 years, we can see that the upper end of the humerus is united with the shaft and no epiphyseal lines can be made out. It is smoothly united to form one complete humerus. This brings us to the end of our discussion. Thanks for joining. Bye-bye.